Well, I would like to say tenecteplase is a life-saving drug not only in cardiac patients but also in neuro patients, as we all are aware that it's used in embolic strokes, wherein we use that within that golden hour. Apart from that, I think tenecteplase is a life-saving drug even in our end-stage renal disease patients. As you know that the vascular access is the lifeline of patients on hemodialysis, and the vascular access is prone for a lot of thrombotic complications. You know, the fistulae, which are the lifeline for the dialysis patients, they get thrombosed, and giving tenecteplase has shown amazing results in the thrombosed vascular access. So apart from the thrombosed AV fistulae, we also use the tunnel catheters, which are the lifeline for dialysis patients. So tunnel catheters, again being a foreign body, are prone for this thrombus and also the fibrin sheath. So we use tenecteplase even in dysfunctional tunnel catheters. So yes, I can say that tenecteplase is a life-saving drug in cardiac patients, in neuro patients, as well as in dialysis patients. And in fact, the usage is more frequent in dialysis patients. So there are studies in Western literature wherein they have advocated the use of tenecteplase lock for the catheters for patients who have this tendency to thrombose very frequently. And also there are studies wherein they have used for thrombosed AV fistulae, whether it is salvage or to buy time before we attempt an endovascular salvage. There is a technique called lies and wait technique, wherein we give tenecteplase before the patient is shifted to cath lab, and then our job becomes easier because the thrombus is already lysed and all we have to do is just endovascular intervention. So tenecteplase in US and other Western population is available in 5 mg vials. I am sure Indian companies will also look into that, because we are losing patients because of these thrombosed accesses, and it's high time companies innovated and came up with the renal dose of tenecteplase for the vascular access. And also I would like to add up and sum up saying that your tenecteplase also has a role in oncology patients. So patients who use chemo ports for the chemotherapy. So whenever there are flow disturbances in chemo ports, when I was getting trained in Albany Medical Center in New York, we used to use tenecteplase, pre-filled syringe of tenecteplase, use 4 mg of tenecteplase, give for those dysfunctional chemo ports, and the results were on table, excellent results. So you have a wide basket of applications for tenecteplase.